Speaking to lawmakers at the Legislative Council today, Chief Executive John Lee announced that COVID-19 patients will no longer be subject to mandatory isolation orders from January 30th. Christy Khan reports.
From January 30th, Hong Kong will take a major step forward to normalcy as the city will drop its mandatory isolation requirements for COVID-infected patients. They can choose whether to undergo quarantine on a voluntary basis. Speaking to lawmakers in a question and answer section, Chief Executive John Lee unveiled his decision this morning.
I
announce that I've decided to remove the isolation order.
Lee said COVID-19 will now be treated as an upper respiratory disease. He also emphasized that the removal of isolation order is a significant step towards normalcy, adding that his decision is based on various factors, including the very sound barrier of immunity that the city has developed.
This important step is based on scientific evidence and is risk-based. This is an inevitable step experienced by overseas countries and is one for Hong Kong. We have reached this stage.
In a press conference this afternoon, the authorities said they will issue a set of guidelines to COVID patients instead. For example, asymptomatic patients are free to go around in the community and can choose to go to work or not, but those with symptoms are advised to stay at home. People who are infected with COVID are eligible to take sick leave if they have medical certificates. Healthcare workers in residential care homes and students who come down with the virus should not go to their workplace or school until they test negative for the virus. Meanwhile, some services, including the Center for Health Protection's online reporting platform and service hotline for COVID-infected people, and the hospital authorities' remote consultation service, will be suspended from January 30th. And community isolation facilities will remain in operation until late February. Secretary for Health Lo Chung-Mau warned that the public should continue to treat COVID-19 as an issue of public health importance.
But I don't think we should, just because of the term endemic, regard this disease of lesser significance. The fact that it's still spreading in our community and the fact that it is affecting our high-risk group, such as the elderly and our young kids, and also the fact that it's affecting our healthcare system, means that we have to continue our fight against this disease.
Although the authorities have eased more anti-COVID measures, there's still no sign the mask mandate will be scrapped anytime soon. Christy Khan, TVB News.